hospital, you only have one patient. Have you ever been in clinic or ordeal when you only have one patient? No, okay? So that's something you have to remember. You have one patient, so you're never in a hurry, okay? It's not a big deal. You can take your time with stuff. Even if it's an emergency type situation, you're just focusing in on that one patient, okay? So that makes it a little bit easier. Doctors aren't allowed in the hospital. They're always asking you, what would you recommend? What would you recommend? What are you gonna do? So you have to make the decisions and the choices. They're not just gonna tell you what to do, okay? You never leave the room because how many patients are you taking care of? One patient. And in that room, you have a magic equipment cabinet. You open it up, you have one of every known piece of respiratory equipment, okay? So you may not use, you don't use Meta-Nets? Okay. Maybe you don't use Meta-Nets at your hospital or something, but if that's the best option for your patient, that's still what you're gonna pick, okay? So you can't just say, well, I've never used that, you know, look at a choice and go, I've never done that one before kind of thing. It doesn't matter, okay? So you're gonna do whatever's best for your patient, okay? And the absolute best thing about this hospital is patient never dies, okay? So you're never gonna get a little pop-up note going in your clinic, we killed your patient, okay? It'll just keep saying, make another choice or end the problem kind of thing, okay? So I was kind of mean as a teacher because I would give, like, you know, patient scenarios, little case studies, you know, this patient in the ER, this is going on with them, and sometimes the answer could be so bad, I'd write on there, you killed him. You killed your patient, or Mr. Smith, you know. So MBRC is not gonna say that to you. So that's kind of a good thing, yeah. So when you take this, it's multiple choice, you're gonna end up with 160 questions. 20 of them don't count against you. Only 140 are scores. 20 are just questions they're trying out for next year's test, that's all, okay? You don't know which 20 they are, they just throw them in there. So if you get a really weird question that you're like, what in the world is this, okay? I've taken, before they kind of got so tight on test security and went to computer and stuff, they used to get volunteers to come take the test. I already had their credentials every 5 years, so I used to volunteer and go take this all the time kind of stuff. And I would get the questions, even after 20 and 30 years of experience, I'm like, what are they talking about? I have never heard of that. And I would just go, you know, that's that question they're trying out. Everybody in the country is gonna screw it up and they're gonna throw it away. So don't worry about it, okay? You'll get 2 cut scores. Your low cut score is 86 and your high cut score is 92. When you get your low cut score, when you pass at the low cut score, you're gonna get a CRT credential, okay? You have to pass at the high cut score though to be eligible to go take your clean SIMS. Got to turn on the recorder, but it's not really good stuff yet. So if you pass at the high cut score, you get the CRT credential, and then you're eligible for the clean SIMS. You pass the clean SIMS and you get your CRT. So 86 for low cut, 92 for high cut, that's not but 6 more questions to get right. And that also means if you get 96 right out of them, that means that you can miss 68 questions and still pass at high cut. Okay, so it's not that intimidating of a number if you think about it. Okay?
You could miss how many? 68?
68.
Out of 140?
You still pass. Out of that 160.
Okay.
Because you don't know what
20
don't
yeah.
count. Yeah.
That does sound less intimidating.
Less intimidating. When you do the percentage, I think 96 out of it is like a 67% or something, so it's not even 75%. So there's 3 different levels of questions that they're gonna ask you. So we'll kind of talk about this as we go. Sometimes if you understand the type of question, it makes it a little bit easier to answer, okay? So the first one is a recall question. So this is just recognition or recall of your information. It's memorization, okay? And we'll look at some examples here. Okay? Application is a simple interpretation. Maybe they give you a blood gas and they ask you what's wrong with it. Okay, something like that. So you gotta know your normal values for your lab stuff. You gotta know normal stuff and everything, okay? The analysis questions might be the little, what you think of as those long questions. You got the questions that if it was on paper, it'd take up the full page. Here's your patient scenario, here's your vent settings, there's your blood gas, there's your lab. And it's not just what's wrong, it's like, what are you gonna recommend to do? How are you gonna fix them? So you have to figure out what's wrong and then how to fix them. So they're a little bit longer in there, okay? So if you look at level 1, this is a recall. So what's the normal range for PaCO2 in a healthy adult patient? What's normal CO2? Yeah, 35 to 45, okay? So it's just a recall, it's easy, it's memorization, unless you don't know it, and then you're kinda screwed. Okay. So it's just the memorization stuff, so this will be a lot of your lab data and this kind of stuff. Application is, patient has a PaO2 of 175 torr. You should conclude that the patient is, so you have to know what's a normal PaO2 is 80 to 100, and you have to know 175 is higher. So how do you get a PaO2 of 175? They're on oxygen therapy, yeah, okay. Analysis questions could be a little bit more in depth, so now, you're gonna see some heart rhythms, you're gonna see maybe even an x-ray come up there. They're gonna have maybe a different little picture, there's gonna be some vent waveforms on there. It's human nature, when you see a picture, that's what your eye goes to. Gotta look at that, okay? Okay, look at it, and then come back to the question, all right? You gotta put it in context with that question. So it says the patient's being resuscitated in ICU, he's pulseless and apneic. Cardiac monitor shows the following rhythm. So what is this rhythm? What do you think? We're looking at it as a coarse VFib, okay? If you were thinking maybe a VTAC or something, it might have been like VTACing over here, and now it's like a coarse VFib. But what's important in that question? What information are they telling you too?
Pulseless.
He's pulseless and apneic, okay? So even if you were thinking VTAC is pulseless, okay, but this is VFib, no pulse. What do we do for VFib? We defibrillate, okay? So when you look at the question, it says their initial action should be to perform D, unsynchronized defibrillation. So what I want you to do too, a test taking tip, is make all of these multiple choice questions open-ended questions. Meaning that when you look at this question, come up with an answer. Open-ended is kind of like fill in the blank, okay? Come up with the answer before you look at A, B, C, and D. So in the old days, it was on paper, I'd tell my students, put your hand over the answers. Answer it before you look at it, okay? Because they're gonna have some really good distractors in here, okay? If you hadn't already thought what you wanted to do and you just read through it real quick and you got to the answers, look at A, endotracheal intubation. He's apneic. Is he gonna need to be intubated? Probably, but is that your initial action? It's always gonna be your first or your initial action. Another thing to remember is you can only do one thing at a time here, okay? In real life, if you get a bad blood gas, CO2's high, PO2's low, you go to the ventilator, you turn this knob, you turn that knob, you turn this knob. We tweak it a lot, okay? It's not really good, okay? Because if they get better, you don't know which one made them better. Or if they got worse, you don't know which adjustment made them worse, okay? In BRC, we'll only let you do one thing at a time, okay? So you gotta pick out what's the most important thing. And here, it's gonna be defibrillation, okay? So endotracheal intubation is a good answer, but it's not the best answer, okay? These type questions are gonna make you mad. You're like, there's more than 2 right answers in there. They're good, but there's only gonna be one best. And it says initial action, okay? What is peripheral venous catheterization? That's a really fancy way of saying putting an IV in. Peripheral venous catheterization. Let's put an IV in. Is this guy gonna need an IV?
Mm-hmm.
Yeah, but what's he gonna need first?
Right.
He's gonna need to be defibrillated first, okay? Unsynchronized defibrillation, all defibrillations are unsynchronized, okay? All cardioversions have to be synchronized, but you don't cardiovert VFib, okay? So you have 3 good choices in there. Intubate them, put an IV in, or defibrillate them. But what's your best initial choice is defibrillation. Okay? Now, as an RT student, you probably have never done this, but have you ever heard or seen a respiratory therapist that actually is defibrillated? Okay. It's not that common, so I've done it once in 40-something years, and again, it was on night shift. The patient was on the ventilator when he coded, and so there was an RT bagging them. Nurses were doing some stuff. I was actually recording for them because I was like kind of an extra person. And I was like, I've never gotten defibrillated. She's like, you want to push the button? And I was like, yeah. So it was the pad, so it wasn't as fun as the paddle. And you just go clear and you push the button. It's not as exciting as you think it is. But, so even if it's not something you think RTs do in their scope, you're still gonna recommend it as the initial action, okay? So it may be to put in a chest tube or something, defibrillate. So don't go back and look at this and go, well, I'm the RT, the only thing up there I can do is intubate, so let me take that one, okay? So don't do that. But just as a good example, there can be more than one good answer, but only one best answer, okay? So if you think, you know, what the answer is before you look at your choices, you're not gonna get distracted with the others. Okay? Alright, so on the exam, when you look at the total number of questions in your TMC exam, and the NBRC tells you this on their website, you can go, look under the TMC exam, and underneath there'll be a link for test content. You can click on that and it tells you what's gonna be on the test. 12, 13 something pages and stuff, everything. Okay? But it also will tell you how many questions will come from where those questions are gonna be. So we know that there's like 24% recall, 47% application. So that's something like 71% of your questions are recall and applications, which you might think of as the easier stuff. Okay? If you add those up, that's 99 questions, high cut score is 96. If you miss every analysis question and get all the others right, you can still pass at the high cut score. So if those big, long questions scare you, okay, don't let them scare you, it's okay. You're bound to get some of those right anyway, okay? That's what we're gonna work on today, is getting some of those more complicated questions right, okay? Recall is, again, is mostly memorization. I can't really help you with that. You gotta do that on your own. So, how you wanna answer your questions, and what we're looking at already is to analyze, summarize, and prioritize. Y'all do SOAP notes?
Yes.
Mhm.
Okay, there you go. Your S and your O, subjective and objective, that's your analyzing, okay? So if you're doing SOAP notes, you're ahead of the game. So think, what's the subjective data telling me, what's my objective data telling me? A is your assessment, that's your analyze, okay? What's going on with my patient? The big thing here is P is plan, but I want you to think of it prioritizing. You may have to plan several different things, okay? Which one is taking top priority? So analyze, summarize, and prioritize. So, pre-test, I want you to go ahead and open up your study guide. I've already got it. First little page gives you all the seminar faculty. Don't think I'm a fraud because I'm not on that page. This was published before I started working, so I'll be on the next one. You look at the top, Scott McNeely. Look at all those credentials. He's the guy who actually created Kettering in 1979, so it's been around 47 years, something like that, okay? And then if you start flipping over, we've got our little review here, we've got our table of content, got references for you, and then you get to a pre-test, okay? So pre-test is 30 questions. I want you to go through it pretty quick, just answer it, first impressions, answer, kind of stuff, okay? Look on page 13. That's your key. Do not look at the key when you're taking the pre-test, okay? It doesn't matter, your score is not important here, it doesn't matter, nobody's seeing this but you, okay? What we're using this for is to see where your weak areas are and where your strong areas are. So what I would do is when you get through with the test, look on page 13, mark on 13, put an X by yours that you missed on that page, okay? Take your test in pencil, so later on you can erase it and redo it in a couple of weeks, okay? Look over on 14 and 15. This is analysis. So once you get done, and you've marked what you missed on page 13, if you look on page 14, this is gonna break them into recall, application, and analysis. So by recall, questions 1, 2, 9, 12, 16, 21, and 26 are all recall. You're gonna count up how many of those you got right. And you're gonna put that in the little box that says my score. Passing score is 5. If you got 5 or better, you passed. If you got less than 5, you failed. This will help you see how well you take each type of these questions. Okay? Page 15 is content. I think 15 is a little bit more important here. Okay? So questions 1 through 8 come from patient assessment. So you're gonna count up how many of those did you get right, put that in your my score. Okay? Passing score is 6. If you got 6 or better, you passed it. If you got less than 6, you failed patient assessment. So you put a little F under in that column. Once you get done with this, you're gonna see where are my weak areas, and that's gonna be different for everybody, okay? So So I can't say, y'all all are gonna screw up on mechanical ventilation, some of y'all may ace it, okay? Or y'all gonna do great on airway care, but maybe you don't. So you're gonna find your weak areas. That next semester, when you're doing your seminar, your review class, that's where you're gonna spend most of your time, is in your weak areas, okay? Those are the questions that scare you, right? So if you look at practice clin sims, you're like, ooh, that's a baby. I don't wanna do a baby. You need to do the baby, okay? If you're scared of it, you need to do it. Right? So I'm gonna give you, 30 minutes, so 8:36. We'll come back at 9:10. So that gives you 20 minutes to do it. I'm pushing you a little bit on the questions, a little bit of time to score it, take a break if you need to, okay?
I have a question.
Yes.
Am I allowed to, these are noise cancellation?
Sure,
Okay.
yeah.